Hi, I'm Victoria Limely,
I'm Selena Kirby.
and we're going to be talking about acetabular labral tears today. So, our patient is a 21-year-old kicker for our football team who was hurt on October 22nd, which was a Tuesday, came in to us on a Thursday complaining of sharp groin pain. We saw some other signs and symptoms that he had, C-sign pain, pain that worsens with activity in long periods of time of sitting, standing, or walking, also inguinal clicking and hip giving way. We had imaging done to figure out and confirm that it was a labral tear, because also impingement can have the same signs and symptoms. Previous injuries, he's just had a right hamstring strain his freshman year, but he's all good and ready to go. The anatomy of the labrum is shown here through these pictures. It is the red horseshoe-shaped ring in the picture on the bottom, and the middle picture shows the blood supply of the area, and then the most common mechanism of injury is with an external rotation force while the hip is hyperextended. So, such as a car crash could cause this. Also, these are the precautions to take during rehab that we found with the protocol that we have chosen. It shows what you're worried about for each phase.
Okay, the surgical procedure we chose was arthroscopic surgery. He had the surgery on November 12th. And what they did was they sewed the labrum back onto the acetabulum. The reason why we chose that was it's less invasive and it had a quicker recovery time. Now, the major differences between the surgical and non-surgical rehab was time, 6 to 8 weeks for the non-operative versus up to 13 weeks for post-op. And the other differences was the criteria for moving on. I'm not going to name them all because they're listed right there for you. The exercises were very similar. Non-surgical works a lot on their gait and any posture corrections which may have been causing anything. Okay, this is phase 1, inactive inflammation, and it's going to cover weeks 1 and 2 of the rehabilitation. Our first goal will be he will reduce his pain from 7 to 10 to 3 to 10 in 3 weeks using IFC. And the reason why is IFC will help to reduce both the pain and inflammation. And we're going to use it with ice because it helps both as well. The second goal is to maintain current range of motion of his ankles while being both non-weight bearing and partial weight bearing. We're going to measure that with the goniometer, and it's going to be over the next 6 weeks. And we want to use that because keeping the range of motion of his ankle will help him. Hi, I'm Selena, and today we are going to demonstrate rehab exercises for phase 1 and 2 of post-op hip labral repairs. Okay, for phase 1, we are going to use IFC and ice. IFC is an E-stem. It's going to help with the pain and the swelling. We're going to go for 10 minutes. And you can see how we set it up here. We're going to have 4 electrodes placed, and they're going to be crisscrossed from each other so that the white, red, and black are crisscrossed from each other, and this one is going to be crisscrossed from each other. I'm going to put these electrodes on you, and I'm going to put them, you can just slide that down just a little bit. There we go, perfect. Okay. One right there. And what we're going to do is we're going to put these across from each other, and we're not going to actually touch your incisions, okay? Awesome. Oops. Pardon my hands. I'm just going to put that under. I think I did that right. Okay. So what I want you to do is slide down to the end of the table, not that far, just so that your ankles are hanging over. A little bit more. Thank you. Okay, what I want you to do is I want you to sit there, and I want you to pull your toes up to you. Good. And I want you to do 3 sets of 10 on both legs. Does it hurt anywhere when you do that?
No.
Okay, that's good. Okay, what I want you to do is I want you to go heel raises. So I want you to take your foot and just raise your heel off the ground. But I don't want you to use your hips at all. I just want you to use your knees and your calves. And I want you to do about eight on each side. How does that feel? Any pain in your hip? No. Phase 2 is active and early proliferation. It's going to be weeks 3 to 9. Our first goal in this phase is he will further reduce his pain from a 3 out of 10 to a 0 out of 10 at rest in the next 6 weeks. And justification is because we're going to use ultrasound, we're going to use low heat on a subacute injury, which helps to reduce pain, muscle spasm, and increase blood flow, which will help to speed up healing. Our second goal is we're going to increase his core strength by increasing the amount of time he holds the Superman position for starting at 3 seconds, moving up to 6 seconds. The reason why is the core strength is important for a kicker, and it's going to be important for him when he's on crutches. Third goal, the patient will increase his flexibility of the hip by 6 degrees in 3 weeks measured with a goniometer. Justification, stretching will keep his muscles loose and increase his flexibility at the joints of the knee and hip. Okay, we're going to do ultrasound. Today it's going to be at 3.3 megahertz, duty cycle of 50%, so it's non-thermal. And we're doing that so that it'll reduce pain, increase blood flow, and reduce any muscle spasms that'll be there. Okay, next we're going to do ultrasound. So I can get you to lay down again. And if I can get you to pull your shirt up and just your pants down a little bit. So what we're going to put on you is some ultrasound gel. Maybe. If I can get it to come down. It's going to be cold. Okay. So don't get any gel on you. Okay. What we're going to do is we're going to do something called a joint move. What we're going to do is you're just going to move your femur on your hip. Okay? May feel funny. You may not even notice it. So, but it's supposed to help with pain. Okay? So, if it makes it worse, let me know. Okay? Okay? So, if I can get you to lay back. Perfect. What I'm going to do, the big thing is you need to relax. Okay. Okay. Sorry if my watch scratched you. So, are my hands. Okay. Okay. Hamstring stretch. I want you to lay it on your back. Okay. I want you to take the belt. If I can unravel it. Okay, hold it one side in each hand. And I'm going to put it around your foot. And I want you to pull your foot up. And I want you to bring your leg up. And keep pulling it. Keep going as far as you can.
I feel it right here.
Okay, that's good. Lay over on your stomach. Okay, now you can use the belt again if you need to. But if you don't, you can pull your foot all the way up to your back. And I want you to stretch your quad up. So if you can't reach it back with your hands, you can use this.
Got it.
Okay. Then what I want you to do is just bend forward with this leg. Like that, and I want you to stretch right on your hip flexors, which are these parts right here. Okay. But don't bounce. Just a nice gradual stretch. So can I get you to lay on your stomach? Okay. Now what I want you to do is do a Superman, but I don't want you to lift your leg too much. Okay?
Okay.
As much as you can without pain. And I want you to do 10 of those. Any pain with those?
No.
Okay. The exercise we're going to do is called quadruped. Okay, and I want you on all fours. And then what I want you to do is I want you to lift the opposite arm and leg at the same time. Kind of like the Superman we were doing, but you're on all fours this time, and only one leg and one arm. Okay, so go ahead and try that. And I want you to do 5 each side. Standing quarter mini squats. Okay, so they're just exactly what they say, mini squats. You're gonna stand, do a mini squat, and a heel raise. Down, up. Mini squat, heel raise, down, up. Okay, see how those do.
So in phase 3, the resistive phase, which is about weeks 7 through 11, the goal first that I have for him is he will be increasing his weight from 70 pounds to 80 pounds when doing 4 sets of 10 of hip adduction on the machine within 2 weeks. The exercises are listed there, and the reason I picked those was they're good for early strength, focus on multiple muscles in the lower extremity, and those are going to be really helpful with his balance later on. So for the second goal that I have for him, he will improve single leg swings holding onto a wall to holding onto just a stick within 1 week with 2 errors or less. So those errors could be putting that second leg down during the swing and being off balance. I picked these exercises to get to that goal because they require a lot of just core strength, strength in general, and proprioception.
Hi, I'm Victoria, and I will be demonstrating rehab phases 3 and 4 for a post-op hip labral tear. For phase 3, the first exercise that we're going to be doing are clamshells. Your patient is going to perform them laying on either side, both sides, and so they can pick whichever side they want to work on first. So go ahead and pick which side you want to lay down on. And their knees will be bent like so, and one important thing to make sure that happens here is that their hips don't rotate backwards, but that they stay in a straight line, like their shoulders and their hips should be in a straight line. Nothing shouldn't be moving forward or backwards. And their heels and the medial side of their feet stay touching, and they will just bring this top knee up and back down, and they will have resistance on as well. She will bring that top knee up as far as she can and close. And for this, we are going to be performing 4 sets of 10. So for the next exercise in phase 3, we're going to be doing a straight leg kick with resistance. And so the motion that a patient is going to be going through, you're going to do it on both legs. The resistance will be around the distal part of their shin. You have their leg externally rotated slightly, so that way they can work on, a lot of kickers come through across their body, and so we want to work on the eccentric deceleration of their kicking leg, and so you're going to be coming through and controlling the resistance back down. So now my patient will be demonstrating the exercise with resistance, and the kicker will be doing this for 4 sets of 10. Kicking out forcefully and controlling it back down. It's really important not to let the band just tug your leg back, so we can work on that eccentric deceleration. Another exercise for phase 3 is just going to be lateral lunges. Your patient's going to be here, stepping up to the side and trying to get their thigh parallel with the ground. You can start on this side, or you can alternate as long as your patient's getting there. And it's going to be 3 sets of 10 on both sides. For our last exercise in phase 3, we'll have eccentric box drop downs. So it's really important here to work on just your balance and landing correctly. So the patient will be up here with their injured leg hanging off the side. You'll do it on both legs, but either one is fine. We're just going to start with the injured leg. So you're here, knee is slightly bent, you're just dropping and landing, catching yourself, coming back up. And again. Now I have my patient.
For phase 4, we're in the aggressive phase, remodeling, and this is going to be for weeks 10 to 13 and on. So here, the first goal, we're going to work on decreasing the time it takes for him to complete a cutting drill by 2 seconds within 4 days. The exercises that I've picked below will help him reach his goal. I picked these because they focus on speed, and kickers, after they kick the ball, they have to play defense sometimes, and that's going to require cutting to go get that offensive player. The second goal that I have written for him is he's going to progress from making 20-yard field goals to 30-yard field goals, making 6 out of 8 attempts within 1 week. So the first and second exercise there will help him reach those goals. The reason I picked these is it's really just focusing on his mechanics and getting back to how he genuinely plays, and hopefully we can get him back stronger and better than before.
So now we're going to start phase 4, the aggressive phase. And so this is working on sport-specific functional training for your athletes. So for this drill, we have cone drill, and the patient will be sprinting first, shuffling, back pedal, and then sprinting through again. So they're here, starting behind code 1, sprint, shuffle, back pedal, and sprinting. So the next exercise that we have are box steps. So you're going to be here, starting with whichever foot is comfortable for the patient, and you'll be switching feet. And the key here, you want to be switching your feet midair, and your patient will go through this 4 sets of 30 seconds, and definitely have a break in between. So the next exercise that we have is called the no approach field goal kick. And so this is to mainly work on the kicker's technique as he's coming back to practice. So one thing that you want to make sure of is that your planting foot is parallel with the ball, and your kicking leg, you're going to be at about 2 o'clock with your leg rotated out. It's important to keep your toes pointed through the whole entire kick. And so when you're coming for the kick, it's important to get the shin parallel with the ground, and then you're kicking all the way through, toes pointed. So let's see here, you're here, 2 o'clock, coming up, through a third of the ball.
So for the next exercise, the patient will be kicking just an extra point field goal. This helps him to progress to the goal that we're trying to have him meet of progressing from kicking 20 yards to 30 yards.
And listed is our bibliography that shows everything we have used and incorporated in this presentation.